Hello and welcome to another episode of Soul Nectar Show, that show where we talk about all things essence, where we gather around the campfire together and we share stories of our amazing discoveries and journeys as a human that is a spiritual being walking the earth. And the moment that we maybe came to some profound realization and then turned that into a passion or a purpose. And it's just really exciting always to gather here for Soul Nectar Show and to see what's going to be talked about next. So I'm your host, Carrie Hummingbird, and I love having these kinds of conversations. And what I love even more than that is guiding people into finding their own true path that's laid out just for them and learning how to follow the breadcrumbs and learning how to have that personal, intimate conversation with the divine that's only for you. I love helping clients to get to that space where they're having that all the time and these magical synchronicities happen just like they have for me. So I love it. And that's what I love to do. And I love to do that in a way on this show because I get to hear, the behind the scenes on all these amazing people and what their journeys were like. So today, we are inviting Melanie Weller. Welcome, Melanie, for being part of the show today.
Thank you, Carrie. I'm so excited to be here.
It's really, I met Melanie like a month ago or something at a podcast festival, and instantly I was like, who are you? So my little, this is something cool radar went off. I had to find out all about it. So Melanie, and we're going to find out about her story, but she's a physical therapist, board certified orthopedic clinical specialist, certified athletic trainer, and certified exercise expert for aging adults. She has completed training with the Center for Mind-Body Medicine, HeartMath Institute, Conversational Intelligence for Coaches, Findlay College, and the Center for Psychological Astrology. She has come to understand her gift in helping patients identify the spiritual underpinnings of their physical dysfunction. Okay, you guys know I love that, right? Skills, not pills. This is so cool. She now uses her vast array of technical skills and medium psychic-shamanic skills to create systems for understanding the physical expression of our internal narratives. These systems include decompressing the vagus nerve, mythology as a mode of transmitting scientific information, and how the mechanics of the earth and solar system manifest in our physical bodies. What? So now you guys understand why I was like, what do you do? Who are you? What? This is so freaking cool. So we're going to get into it now because we don't want to delay. So, okay, I always start every show because I want to find out, okay, who are you and how did all this amazing wisdom just stumble into you or through you, however the case may be. So let's start off with your journey. This is so cool. I'm so excited.
Thank you. It's been an amazing journey myself. I guess when I think about how it all stumbled into me, I can see it in steps. I consider my understanding of the vagus nerve and where it gets compressed in large part the result of how my own vagus nerve was compressed at a very young age, and that this has been, and that as I've done it for patients, I've also been learning to do it for myself at a deeper level. And that's just part of why I'm kind of solving my own problem. And I think we all do what we need to heal ourselves the most.
Absolutely. Absolutely.
And I love the vagus nerve because it affects so many different things. Treating it is very much like applying a magic wand to the body. You get changes that are always amazing and unexpected, and I love surprising myself continually. And I've been a physical therapist for nearly 25 years now, and I was really fortunate to have a very progressive education at the University of Southern California and to have some amazing mentors very early in my career that really led me to challenge myself to find the one or two things that would make 5 or 10 or 20 things better in somebody's body. That I would, to really look for what that root cause is and not go chasing symptoms. And I really enjoyed that game. I could kind of make a game of it. I loved kind of that puzzle of trying to figure out where could I go and kind of get everything to to shift. And I ended up early on working with a lot of complicated chronic pain patients that hadn't had success anywhere else. And they had been to other physical therapy clinics. They had had often multiple surgeries and seen a myriad of other practitioners without any success. And so I learned very quickly not to do the same things that they had already had. And concurrently, I ended up taking some visceral mobilization courses, and I took a few courses, including a cranial one from the Michigan State University's College of Osteopathic Medicine. And so I just acquired this very diverse skill set very early on. And the universe really sends you, or I found, and I know other clinicians that would say this too, that the universe sends you patients in clusters to sort of teach you things. It's like, you know, 1 week it would seem like shoulder week, like everybody's got a shoulder problem. And then a couple weeks later, it would be like everybody's got a knee problem. And just to give you one example, maybe about 12 years ago, I had a bunch of, I had 4 or 5 middle-aged women with that were having knee pain, specifically a kneecap issue, a patellofemoral pain. And I had a nerve release for the thigh that I'd used for many years, and it always worked amazingly on these patients and made everything dramatically better. And then it was like one day it stopped working, and on all of them. And so
Wow.
I was like, why isn't this, you know, why is this not working? And so I sort of wiped the slate clean, you know, as they, you know, came back in for subsequent visits. And I was like, all right, so if they're not responding to the nerve technique there, their nervous system must be stuck more somewhere else in their body. And that was where I really started to connect how treating the vagus nerve, even at the base of the skull, would change knee mechanics and change foot mechanics. And, you know, just how incredibly far-reaching it was. And so when I got a glimpse of that, I was like, oh, what else can I do with that? And so it's just been a real evolution of everything. And I would see patients, especially when we moved to New Orleans and I had my own practice, I would see women for back pain, and, you know, they'd come back so I'd treat them for back pain, and then they'd come back the second visit and tell me things like, I've had pelvic pain for the last, you know, 8 or 10 years since my last child was born, and now it's gone. What did you do? And my sex drive is increased, or, you know, things are just different in my pelvis and I can't quite describe it, but in a good way. And that really led me to realize that I was also, some of the techniques I was using with the pelvis were also decompressing the vagus nerve down through the pelvic floor. And so there's just lots of little kind of happy synchronicities that allowed me to see that. And I have even had 2 clients with acute onset of hallucinations that have had their hallucinations resolve with my vagus nerve techniques, which is amazing because I had no idea that I could do that. And so the range of diagnoses and symptoms that it improves just never ceases to amaze me.
Yeah, that's so fascinating. So for people that don't know what the vagus nerve is, what is the vagus nerve?
So the vagus nerve is your 10th cranial nerve. You have 12 nerves that come out of your brainstem. And they're all outside of your spinal cord. And so your vagus nerve is your 10th one. So the easiest way to recognize it is when we get stressed and you get that lump in your throat and your palms start to sweat and your heart's racing and your stomach starts to churn. Those are all vagus nerve mediated functions. And you get those symptoms because your vagus nerve has gotten dialed down. And so your fight and flight system has gotten dialed up. Your vagus nerve is all about rest and digest and pleasure. And when it gets dialed down, your stress systems start to escalate. But the research on the vagus nerve is really amazing beyond that. A lot of times what they do in the research is they'll use an electrical stimulation that they'll use electrical stimulation to the vagus nerve. And neurosurgeons will sometimes implant a vagus nerve stimulator for patients that have seizure disorders or sometimes chronic pain like fibromyalgia or chronic fatigue syndrome. And in the research, they found that vagus nerve stimulation reverses the mitochondrial defects that go with ischemic heart disease, like heart disease from lack of blood flow. It reverses insulin resistance in diabetics. And just has, it just like, it's always amazing. Women with complete spinal cord injuries with vagus nerve stimulation is amazing because they don't have any motor function through their pelvic area because of their spinal cord injury. But because the vagus nerve is outside of the spinal cord, they can use some self-stimulation to achieve orgasm. So your vagus nerve is really important to your pleasure pathways. And as a physical therapist, it mediates inflammation. So that's really where I love treating it, because I see people in pain. And when you give them better inflammation mediation, they get less pain.
That is so cool. That's so cool that you stumbled upon this. And not only that, but you had more discoveries about the vagus nerve, and you had discoveries around I think it's really interesting that you are a spiritual person, but you're doing all this scientific stuff. That's just weird.
Well, I think, what I've come to realize in hindsight, so what I'm really good at, and I tell you what my gift is helping people with the spiritual underpinnings of their physical dysfunction. And I'm very hardwired for logic. And I think for years, I thought my intuition was my logic. I didn't really see them as any different. I was like, of course that person has a history of abuse and, or that there was, to be able to kind of see their traumas. But I didn't, for years and years, I don't think I ever thought I was being psychic. I just think I thought I was being logical.
Wow, that's so amazing. Because that's a place where a lot of people get tripped up is they have these intuitive insights, but they're told kind of early on that that's not logical. So you somehow escaped that paradigm, and you thought that all those intuitive insights were actually logic.
Yes.
That's amazing.
So, but then it all, when I got into, when I was in my early 40s, it really started they really started to distinguish themselves from each other, because I would often talk in metaphor to clients just to help them understand what was happening. And when I would start describing things that I was seeing in my mind's eye, like one of the earliest situations I was describing, it's like there's this woman and she's in a pink suit and she's got a pink orchid on her lapel and she's dressed like this and my patient said, that's what we buried my grandmother in.
Wow.
And I had no idea that I was doing mediumship at the time, or that any of those images were associated with that. And as I started to come out of the my own closet with it, to be more authentic with patients about what was actually happening, because I'll say I do pick up when I do understand how emotions manifest in the body, but to me it's really very much like a vibration. Like there's a specific pattern that goes with anger and sadness and rage and grief and whatnot. So to me, it was a very mechanical assessment, not so much an intuitive assessment. But as I opened things up, and I would tell patients, like the first person I told, I said, I know this is going to sound really crazy, but I think you have a ghost in your neck. And she looked at me and said, I can tell you exactly when that happened. And she had a whole story to go with it.
That's amazing.
And the next, later that same week, I had somebody, and I was working kind of around her diaphragm area. And I said, there's a book you need to get rid of. And she looked at me and said, I know exactly what book you're talking about. And had a whole story to go with that. And even moving forward a little bit. So I learned not to question it, because no matter how ridiculous I thought it was, it almost always resonated with the patient. And probably my favorite story of all time is I had a patient that came in for kind of a hip issue, and it wasn't getting better. And, I couldn't figure out what was it. And I knew she needed to release something, but it wasn't my normal laundry list of things to release. And so I quieted down, and what I heard is that she needed to release her bacon. And I had this argument in my head, or with my higher self or whoever. I'm like, she needs to release her bacon. I'm like, yes. And I was like, okay, but I'm not going to tell her that because that's ridiculous. And then it was a ton better immediately after doing that, after I, released her bacon the way that I release whatever, anything. And she said, this woman's a force of nature. She said, what did you do? I said, I'm not telling you. She's like, oh, what did you do? And so I told her, and I knew in her younger years that she had had a history of depression. What I didn't know is when she was really depressed, she would eat a bacon, lettuce, and tomato sandwich or a bacon and egg salad sandwich. And
wow.
So for her, bacon and depression were inextricably linked. And so her body was really telling me that she needed to release her depression.
But it knew it as bacon.
Just knew it as bacon. And so I thought it was ridiculous, but it was really meaningful to her. So I'm much more brave about giving those intuitive insights. But also I really, as I went through things, I felt like there was a way to systematize and empower patients and practitioners to understand how to help patients with the spiritual underpinnings of their physical dysfunction, that it's not all about like picking random things out of the ethers to help guide them, that our bodies are highly structured and operate in many predictable ways. And I think that it can be the same thing with the spiritual underpinnings. Some of us are a little more creative about how we lay them down than others. And that's really where I got into looking at the earth mechanics in the body and in mythology. Because as I was going, as my mediumship and psychic skills were really evolving, stuffing myself into a physical therapy box was getting really uncomfortable, really stressful. And since I had branded myself as a stress management expert and taken, I have a lot of formal training in mind-body medicine and, and then my, the softer, more mediumship psychic training. And so I needed to figure out a way to reconcile them so that they fit better together in my practice.
Absolutely. That's a journey so many of us go on, trying to rectify these left brain and right brain, whether or not there's even that existing. But the concept that there's a logical side and there's an intuitive side.
Absolutely.
Go together.
Absolutely. And so it all really came together when I took a couple years off just to figure out how to make this work, because seeing patients all day, every day wasn't giving me the space to organize it the way that I wanted to. And I read Graham Hancock's Fingerprints of the Gods. And in it, he talks about the myth of Isis and Osiris and how it contains all the numbers of the Earth's precessional cycle, how it rotates and tilts over time, and that there are other major myths from other cultures that have the same numbers. So mythology was a mode of transmitting scientific information. It was how they shared the way the Earth and stars moved together.
That is so cool.
And so the Earth currently is at a 23.5 degree tilt. So my physical therapy brain was like, oh, I wonder what's 23.5 degrees from the midline. So I pulled out my anatomy books, and the opening at the base of the skull where the vagus nerve comes out is 23.5 degrees from the opening where your spinal cord comes out. And there's some other synchronicities in the body. I had a chance to see some real skulls and even some casts of ancient skulls. And that opening, it's called the jugular foramen, where your vagus nerve comes out, is 23.5 degrees is very consistently bisects that area, that opening.
And it's right at the base of your skull, right? Like right at the base of your skull where your skull meets your neck?
Well, it's off to the side a little bit. So because you have a right one and a left one. So there's an opening on each side. So it's actually between your temporal bone, which is under your ears, and your occipital bone, which is the back of your head.
Oh, very cool. Okay. And that's going to be that way for a certain period of time?
Well, I think that, so the Earth, the tilt of the Earth goes from like 21.1 degrees to 24.5 degrees over, I think, a 44,000 year cycle. And the ancient skulls were actually very identical to the modern skulls. And the anthropologist that walked me through this, he said, well, you, like, the base of the skull needs to be a really stable area. Like, it's very, you know, like, it's very well organized. And the ones that had some variation in them, which I'll say particularly the modern ones, because the ancient ones were sometimes found in pieces and put back together. So the very, you know, you maybe don't know exactly how it looked originally as a whole. But the ones that were outside of that 23.5 degree range were so asymmetrical. Want that person's medical history, because I was like, they felt terrible when they were alive. You cannot tell me that somebody had that amount of variation in the base of their skull and did not have some amount of pain or other significant medical issue going on. But I don't have, you know, the bones don't come with their, didn't come with their stories, at least when I was able to see them. So, but you know, that's how, you know, our bodies love symmetry, you know, and the biggest predictor of an injury is previous history of an injury. The second biggest predictor is asymmetry. And we only really have to be about 4% different right to left to have an elevated injury risk. So when things are asymmetrical, that ends up being a big problem. But getting back to the Earth mechanics. So that was the first part, was just kind of thinking about how all of this is coded into it. And at the same time, I was studying astrology just for my own edification and my own self-development. And I did an online teaching around, and then I ended up, it was before the holidays, it was a stress management themed session. And I ended up talking a lot about the ventricles in the brain, which make our cerebral spinal fluid. And for 20 years, I've had this set of anatomy books that have my favorite picture of anything anatomical ever. And it's a compilation of MRI images to give you a 3D picture of what the ventricles of the brain look like. And I thought, and I hadn't opened those anatomy books in a while, but I thought, I'll go snap a picture of that put it on my social media, since I just did it in the stress management session. And when I opened the book, I was really just shocked, because they look exactly like the ram's horns for Aries. And in astrology, Aries rules the head. And so then I was like, oh my gosh, where's the rest of it?
Wow.
And so then I dug deeper into my astrology or into my anatomy book. And so in astrology, Taurus rules the throat, and the way your hyoid bone in your throat sits on top of your larynx looks very much like the symbol for Taurus, like the bull. The bone looks like horns, the horns of the bull. And your aortic arch in your chest is the exact same shape as the symbol for Leo, and Leo rules the heart. Libra rules the kidneys, and the symbol for Libra is the scale. And you can imagine your kidneys hang off of your aorta and inferior vena cava very much like a scale. A woman's reproductive system looks just like a scorpion, where the vagina is the tail, the uterus is the body, and the fallopian tubes are the arms, and the ovaries are the claws. And Scorpio is the only sign that has 3 animal archetypes with it. It also has the snake, which is the male phallus, and then the phoenix, which is, and our pelvises are where we create new life from, where we're born and reborn from.
Wow,
and it just works the whole way through the body. And so what I've come to really understand is that there's an energetic imprint of this in the body too. And so you can, sometimes if I'm treating somebody for a neck issue or a throat or voice issue, I might treat their hyoid bone mechanics specifically, or I might treat their bull. And very often treating the bull resolves the hyoid bone issue, whereas treating the hyoid bone doesn't always resolve the bull issue. So it's an interesting dynamic. But for me, the way I describe it is that it's like speaking to the body in its original language.
That's cool. That's because it has to be very courageous to speak,
Absolutely.
which is like a bull. Like you think about bulls can also be stubborn,
Mm-hmm. Right. So there's many qualities to go with it, but then you can kind of go into the qualities of a bull, or you can look up the myth of Taurus, what Taurus meant. And the Taurus is ruled by Venus. So you might look up the myth of Venus to see what's going on, thinking about speaking about what you love and how you love. If you're not expressing what you love, then your bull might not be in an optimal state.
Wow. Okay. Let's go back to what you just said. If you're not speaking what you love, then you might not be optimal, because your throat is a Taurus, which is ruled by Venus, which is the goddess of love. And so your throat is meant to speak love.
Yes.
Check that out, people. That is so clear.
Yeah, there's many ways to put it together, but I think, because you can use the anatomy, you can use the mythology, you can use the physics, like Uranus, the planet tumbles kind of head over heels. It doesn't rotate on an axis the way the Earth, and some of the other planets do. And so sometimes it's like, well, where are you spinning out of control or rolling down the hill, or that there's kind of this sort of a more chaotic energy to things. So sometimes you can pull in the physics, or like where Mars might be really arid and dry. You can pull these different aspects of I think really the planets in a more but in a more metaphorical sense, and it shows up in how we in our language in different ways, and sometimes how people express. I always ask patients for the metaphor, like, tell me, give me a metaphor for what's going on here. Describe to me more symbolically. And they overwhelmingly describe exactly what's going on.
That's so
I
cool.
just sort of help them hone that message, and so there's you can see it symbolically, and you don't have to be a mythology expert or a cosmologist to figure it out.
Yeah, we were talking about how it's really simple. I remember one of the biggest things I got when I went to energy medicine school after 20 years of psychotherapy, which helped me navigate a lot of thought tunnels, but that's useful. But what's more useful is actually healing. And I went to energy medicine school. They taught me about figuring out where my energy body was. And once I knew where it was doing this practice, what we have of like sharing what they call a wirkocha, our energy body with another person, like kind of pulling it over them and then pulling it back, you become aware of where you are. Like it's like really instant, wow, that's where I'm at. And I saw it in my language the whole time, because people would say, you have no boundaries. Well, okay, but I didn't know where mine were, because they're so permeous. Like I'm a shapeshifter. So yeah, I didn't know where my boundaries were, because I could feel everything that was going on. So it's kind of hard to figure out what was mine and what was theirs. Right. So it was in that clear language, that I started realizing that the language, the whole time I was speaking what I needed, but nobody knew how to help me to get it, because they didn't have the right tools and technology. So I'm seeing the same thing with what you're saying, is that it's in our language. We know exactly what the problem is. As you were even talking about the thread, I was thinking out in Texas, I was saying, if you don't follow along, if you mess with the bull, you'll get the horn,
Yeah, right. Well, sometimes, you can get impaled in the wrong kind of way, maybe that you don't want to. I think one of the most interesting things in the way that, I do see what you see, where people, and I work with people a lot on boundaries, because I think it's important to know where you end and where somebody else begins, or to have, some sense of that. When I was in PT school and newly graduated, whenever I would treat somebody with a headache, they would feel amazing, because I would get their headache. And I had no idea what was happening to me, but I knew that I had their headache in the exact same spot that they or places that they had described, and that they felt amazing. But that's an unsustainable model.
Yeah, you can't just take it all on, right?
Right. And it would happen with vertigo patients sometimes too for me. And so but I was really fortunate to always have somebody there to mentor me through those times and to really help me with those boundaries, and so that I didn't keep absorbing it. And I could always kind of shake it, or brush it off and get it to go away. But, I certainly, I didn't want to spend the rest of my career absorbing people's pains. That's just not practical. I am a big believer that your work should heal you and help you and be fun, and not end up being, you shouldn't have the healer. You shouldn't ever be ending a down ground everybody else's garbage.
Yeah, yeah. Because it is a little bit like being a janitor right now on the earth. Being a healer is sort of like being a janitor, but you don't want to take the trash home. So it's like,
Right.
give it to the earth for transmuting. So, and that's definitely a process to learn how to do that. It's a lot of discernment. It's a lot of figuring out what's yours and what's theirs. And I know that you've had to go through this process in order to even provide the clear guidance for people, or to even see and hear the messages, however it's presenting itself for you, about what they're going through. You have to know yourself really well first in order to do that. Talk a little bit about that journey.
Absolutely. I think that, well, what I've come to realize is that whenever I help someone else heal, I get a piece of that. And overwhelmingly, they're showing me something about myself, or how to develop a new skill, kind of going back to how things come in clusters. But, the evolution of it was really in as my psychic skills evolved, that was hard. I really kind of came unglued, and I have an amazing husband and 2 amazing children, and I nearly left because it was like, I just didn't know who I was, and it was all very confusing, and it was, incredibly unsettling. But I am deeply wired with a lot of restraint. So I was able to just sort of, and I had a lot of support, and I did everything from traditional counseling to astrology to psychic readings, so I did a whole gamut of different kinds of mind, body, spirit work to put it together. But really, so when it started, because I'm so, my back, I come out of the medical system, and, my background's is more in that. The way that I would feel energy would be more in, we know that we inherit the traumas of our ancestors, and that our DNA gets tagged. And I could just feel those tags and then start to shift the energy of that. And I had a huge aha moment when I ran across some images of quantum physics and string theory, because I was like, oh, I know exactly what that is in the body. I feel that all the time. And so it was really this evolution of kind of going from different sort of more scientific piece, feeling the science that, and just in the way that I feel energy, but coming from that more, say more grounded, or a little bit more of a conventional aspect of it, to say well, how can I feel these different things in the body, and then it evolved into the mythology and astrology. But it was, but I'm always looking for, I think that really looking at your clients as a reflection of showing you what you need to heal, as much as you're showing them what they need to heal. One of my mentors many years ago, her name was Elizabeth Noble, and she was well known in the field of physical therapy for pelvic floor health and women's health issues, especially prenatal and postnatal issues. And she said, you just like, you have to look at your OBGYN like they're resolving their birth trauma. And, you know, I think physical therapists are really trying to heal their physical bodies. Like they've got some deep, really practical physical wounding, and that a lot of the psychiatrists are trying to solve their own mental health issues. And it's not always just in this lifetime. You know, I think sometimes it comes through in a very multidimensional way, where if you have a belief system around past lives or, you know, karma, you know, and certainly through epigenetics, you know, sometimes you're really, you know, in the way that in a, you know, shamanic tradition, that when you heal yourself, you heal 7 generations forward and 7 generations back, that, you know, healers are really trying to resolve these things for their whole ancestral line.
Yeah, absolutely. That's one of the things I'm writing about in that channeled in through my book, The Second Wave, which is coming out soon, is about how some of us who came in to be healers actually came in to do that at a soul level, like made that soul agreement, and then forgot, of course, because there's earth amnesia, and then came in and went like, what the heck is going on here? You know, like this is awful, like these people are terrible, and you know, and all this stuff. But like, you got to heal it, and when you heal it, you know, it actually shifts the timeline in some really strange ways that I've been noticing on my own personal journey and with my clients. Is sort of like a disorientation, you know? And so I tell my clients now, like after a healing session, let's say, if they're feeling super disoriented, I'm like, that's really good, because you're going to be reorienting in a better way now. And so, yeah,
Right.
you feel disoriented. That's good, because you don't want to be oriented that old way anymore. You want to be oriented in a new way that's coming in. And it takes a little while for it to trickle into the physical to you fully feel it sometimes. So I know you work at the physical, but you also work at the metaphysical. And so how, you know what I'm talking about. Like there's some
absolutely.
people that
I
feel
think
it.
that, yeah, I'll tell you I know exactly what you're talking to, and I've experienced that on a personal level. I've had many patients sit in my office extra time so that
They can drive.
so they can drive home. Right, exactly. So they're safe to drive
Liability
home.
otherwise.
Right. So I've had that happen many, many times.
It's have a waiting area.
Yeah, I will tell you, with this system, I haven't had it happen as much as I've been working more with. You know, I consider that between the vagus nerve and the earth mechanics and the astrology, mythology piece of it, that's like, to me, that's like the holy trinity of healing.
I mean, it sounds so cool. And actually, you are actually doing energy healing when you're doing that too, because you know, I got to experience a little bit of this, just like a brief moment. It wasn't very long, but it was really cool in that I do have perceptual filters for this because of the work I do, but I was able to feel and perceive the shifts that you were actually making kind of right around here in my throat and in my vagus nerve.
Well, I think I mean, we are energy. And even I think when surgeons are doing surgery, you know, the most brilliant surgeons, and I know several that, you know, they know during surgery that they go into the zone, and some of them know that they have spirit guides that are helping. I know one that is a breast cancer surgeon, and she always gets all the cancer because spirit helps her, and her record for that is amazing. But even for the ones that may not so much see it in the context of spirit, they know they go into a zone often during surgery, and they pick up stuff that other doctors haven't picked up. And getting the physicians to come out of their shells and really talk about that aspect of their practice is hard. Most of them don't really want to admit how intuitive they are on any kind of a big scale.
Well, I like to talk about it because I know that you walk this delicate line, because we'll talk about that in a second, but you go out, you're going to talk to the physicians and things like that to get them to understand this technology. And I'm calling it a technology very deliberately, you know, because it is. And the thing about it is that it's more like there's refinement of perception. Like there's refinement of perception. And when you're really crusty as a human, you really can't perceive a lot of stuff. It's very like dense and clunky. But the more refined your perception gets, the more you can tune in to the nuances and information. Just like, as a first grader has really clunky English, but, by the time you get to be a PhD in English, like you've got a very refined vocabulary that you can be
Mm-hmm.
speaking with. And I think the same is for navigating this dimensional experience of being in a physical body but being spiritual, is that it's the same progress. There's a nuance to the energy, and there's a density to the physicality, and I do equate them in terms of the physicality is more on the clunky side, and then you get up into this beautiful essential spirit side that infuses the physical, that has way more complexity and vocabulary to it.
Absolutely. And I really think the bridge between all of that is the vagus nerve, because it's in all of your senses, and it innervates the pacemaker cells of your heart. And so when we generate our electromagnetic fields that go out about 5 feet or so, all that created an electric field of your heart without your vagus nerve. And so when you're around others, you end up, that's how you connect with others. You overlap electromagnetic fields. And there's research that shows that that our electromagnetic fields synchronize with the electromagnetic field of the earth. And when there's space weather that disrupts the electromagnetic field of the earth, it shows up in our electromagnetic fields. And the extent to which it is disrupted in your life depends on the strength of your interpersonal connections.
Yeah, and your ability to perceive it. Like I can perceive and feel those kinds of electrical storms, because I always know I'm not feeling quite right, or I'm feeling unsettled or ungrounded. I got to go get extra grounding, and then I'll go look it up, and there's a solar flare. Oh,
Right.
stuff going on, or there was just a huge catastrophe over in this other part of the world, and I'm feeling grief, and it's like, what? There's no reason for me to feel grief. Why is that? So I think that it's tuning in, and I think like taking the lid off of the conventional, like clunky way that you think about things, and opening up to like there's this whole vast array of complex information that's actually quite simple to understand if you have the right tools. But it's like,
Absolutely.
it's
Well,
complex,
I think
and rich.
Absolutely. The medical system is very much, operates in very much an either or sort of paradigm, and it has not historically held the space for mind, body, and spirit, though that, for the yes and conversation, though that's starting to change, at least in some areas. And we're seeing that with the rise of functional medicine and naturopathic medicine, and just seeing Reiki in hospitals and different things like that they're really starting to embrace more of that. But the vagus nerve to me is like the mycelium network of the earth that connects all the roots of the plants and everything like that. And I think it's like the Laniakea supercluster in the sky, of which our Milky Way galaxy is one little teeny part. That it's that network, that thing that just connects everything. And it has been my incredible pleasure over and over and over to create change in people that I didn't even think was possible. At least, and especially on the timeline. And it does, you talk about timelines, your vagus nerve really can accelerate your healing timeline, and your connection timeline. I'm getting ready to go up to the main yoga festival and teach telepathy in the vagus nerve with a medium. So
Telepathy and the vagus nerve. So like telepathically connecting to the vagus nerve?
Well, we're going to use the vagus nerve exercises as a warm-up, do a telepathy exercise with the group just to get everybody connected.
That's so cool. Very cool. So now, if people want to know more about this, how do they discover this from you? Like, what's the best way for them to engage? Do you have free resources? How do people connect with you?
I do. If you go to my website, on the homepage, there's a button that says learn more about the Osiris wound. And I love the myth of Isis and Osiris. And I'll just give you a brief description. In the myth, Osiris got chopped up into pieces by his brother. And we use dismemberment metaphors in our language all the time. We say we feel scattered, we can't get it together, we're falling apart, our lives get shattered, our hearts get broken. So I consider a lot stress. I think it's a metaphor for stress. And so if you click on learn more about the Osiris wound, enter your email, it will send you a free vagus nerve decompression course that has some information about the Osiris wound and some of the vagus nerve exercises. If you're interested in doing something on a deeper level, I have a monthly membership where I teach at least once a week, usually twice a week, and on the relationship between all of this, and also do a remote healing. And then I have packages for individual sessions as well.
Awesome, awesome, awesome sauce. Well, that's great. So you guys can check it out. Check out Melanie. Go to her website. I'll put the link in the show notes so you can go download your free online course, online information about the vagus nerve, and get this rebalancing.
Yeah,
and
the website's just my name. It's melanieweller.com.
melanieweller.com. Yeah, so that'll be in the show notes. You guys can do that. And gosh, this has been so cool. I can't wait to find out more about all of this, because I love astrology, and I tune into an astrology forecast every week by Kite Pacha, who I think is groovy and strange and right up my alley, because I'm weird and I like weird people. And I love the fact that you're so straight-laced, and yet like you come up with all this like, holy crap, like really amazing connections between spirituality and science that I'm sure are going to blow the minds of a lot of people out there who think they're separate, because they're totally not.
Yeah, well, it's been an amazing journey, and I've learned through some of my own astrology readings and even more conventional assessments like Enneagram, that I'm a shoreline person, and my ideal location is on that shoreline. And I've spent my entire career bridging science and wisdom and myth and medicine and going between the conventional and the alternative. And it can be a very lonely place to be, and a very difficult place from which to be heard, because you're not fully in anybody's camp. But I think that that's really where we're heading on a collective level. We're going to bridge these things more and more.
Yeah, we're gonna collapse the duality, essentially.
Absolutely.
Yeah.
Absolutely.
And it just makes it's gonna actually, what's gonna happen is it's gonna be way more rich. It's gonna be yes and all over the place instead
Absolutely.
of against versus or. So, well, wonderful. So I'm gonna, at this point, I'm gonna just invite you to give kisses to everybody. I always give kisses at the end of the show, so here they come. You can join me or not. Okay, everybody.
All right.
See you next time on Soul Nectar Show. And if you like this broadcast, go ahead and leave a comment, a like, a share, and let us know what you think, because we'll be paying attention. I have connection to Melanie, so I can get all of your questions answered, kind of, sort of. At least a little bit of them answered. So please leave us a comment, and we'll get back to you as soon as we can. And have a wonderful, wonderful rest of your week. And we'll see you next time on Soul Nectar Show. Bye, everybody.